Today I'm going to talk about esophageal cancer. The definition of esophageal cancer is a cancer that is found anywhere in the esophagus, which is also known as food pipe. And this esophagus connects your mouth to your stomach, as seen in this picture here. So there are two main types of esophageal cancer. 70% are squamous cell carcinoma, 30% are adenocarcinoma. Squamous cell carcinoma can happen anywhere in the esophagus, while adenocarcinoma normally occurs in the lower third and gastroesophageal junction. So we can see in this picture here, the esophagus is divided into three segments, which are the upper third, middle third, and lower third. So on overall, 10% of cancers occur in the upper third, 60% in the middle third, and 30% in the lower third, which is mostly adenocarcinoma. For the risk factors of esophageal cancer, the first one is smoking. Smoking, there is 100 times increased risk for squamous cell carcinoma and 10 times increased risk for adenocarcinoma. Second risk factor is alcohol, where there is 2 times increased risk for esophageal cancer. Obesity is related to the acid reflux, and this increases the incidence of adenocarcinoma. For diet, drinking hot drinks or eating preserved foods that are plenty of nitrosamines or eating bitter nuts can cause esophageal CA. Other risk factors are Barrett's esophagus, meaning the intestinal metaplasia of esophageal mucosa due to the acid reflux. This can increase the risk of cancer due to metaplasia, dysplasia, carcinoma sequence. And the risk of getting esophageal cancer is 30 to 40 times higher compared to individuals without this Barrett's esophagus. Another risk factor is achalasia and caustic injury, where the cancer occurs at the site of a scar or stricture, mostly in the middle third of esophagus. And lastly, Plummer-Vinson syndrome, which is associated with esophageal web and iron deficiency anemia. So the clinical features of esophageal cancer are dysphagia, which is present in 80% of the patients. It is the most common presentation. Weight loss, regurgitation, anemia, vocal cord paralysis, and aspiration pneumonia. For investigations, for diagnosis, there is barium swallow, as seen in the first picture here. And we can see that there is some constrictions at the lower third of the esophagus here. Another investigation is OGDS, which allows biopsy of the lesion in the esophagus, and then can do confirmatory histological diagnosis. For staging, the investigations are endoscopic ultrasound, as seen in this picture here. So if the endoscope can pass around the lesion, the endoscopic ultrasound is good for staging. And also, like in this picture, to identify any enlarged regional lymph nodes. Next is chest X-ray to detect any presence of lung metastasis, any aspiration pneumonia, or pleural pericardial effusion, or any tracheal deviation. Next investigation for staging is the CT or MRI scan of the thorax. Can be used for TNM staging. And for bronchoscopy, it is to exclude bronchial involvement, especially in tumors involving the upper 2/3 of the esophagus. Bone scan is used to detect for bony metastasis, whereas laryngoscope to assess for vocal cord paralysis. For treatment, surgery can be done, like endoluminal surgery, esophagectomy, or palliative debulking for obstructive symptoms. Chemotherapy and radiotherapy can also be done, where squamous cell carcinoma of the esophagus is more radiosensitive compared to adenocarcinoma. Prognosis of esophageal cancer. there's 80% mortality at 1 year, and for overall 5-year survival, it is less than 10%. That's all for this video. Thank you.